Welcome to the Pharmacy Frontiers podcast. We're excited to come to you today with an insightful conversation with Tripp Logan, the NCPA Independent Pharmacist of the Year, with a discussion around how we're bringing new value to community pharmacy practice. Let me remind everyone that the Pharmacy Frontiers podcast is available for streaming on your favorite podcast streaming app, whether it be Apple, Podbean, Spotify, or YouTube. The Pharmacy Frontiers podcast is a podcast dedicated to the pharmacy profession. The comments and opinions shared today are those of myself, our guests, and are not official statements of the NPA, Mercy, Mitchell Family Drug, or TNS Pharmacy. I'm Daniel Good. I'll serve as your co-host today along with Tim Mitchell.
Well, thank you, Daniel. I think we're going to move on in. We'd like to introduce a good friend of mine, Tripp Logan, who's from Southeast Missouri, does a lot of really cool things in pharmacy. Really looking forward to having a discussion today, learning a little more about Tripp. And Tripp, I know you've got a lot of things going on. Tell us about you and your pharmacy, and kind of get us started here. So introduce yourself.
No, I appreciate it, and it's cool to be on this Missouri podcast and understanding that it reaches past Missouri. So I'm here, and so that's great. Honored to be a part of it. So for those that don't know me, Tripp Logan, I'm second generation community pharmacist from Southeast Missouri. Grew up in small little Mississippi Delta town, and took my first steps in one of my dad's drugstores. Thought I'd never be a pharmacist. I was going to get the heck out of here, and went away to college and ended up getting roped right back into what I grew up in. And it's been a blessing to me and my family ever since we moved home. Right now we own and operate pharmacies in Southeast Missouri. We cover 3 counties with pharmacies, brick and mortar. We also have a care coordination clinic that we started a few years ago that covers 7 counties with care coordination services. We could dig into what that looks like. We've got, I think, 10 community health workers on staff now at our place. Technicians cross-trained, all of those. A few working full-time as community health workers, most working within pharmacies, helping patient navigate a really complicated healthcare system, which usually presents itself in the pharmacy. Try to stay involved with organizationally things that can help move pharmacy practice forward, but I'm really selfish in that way. My dad and I know that if we don't move things forward, then our pharmacies aren't going to be there. Tell students and residents that come into our place, our number one responsibility is to keep the doors open, because if we make bad business decisions and we close our doors, we fail everybody in our community. So no pressure.
Yeah. Totally agree. Well, I appreciate what you had to say. And I know, and I think everybody that knows anything about Tripp Logan, that grass does not grow underneath his feet, nor his father or anybody that works for that company. You guys are always, moving ahead in new areas that bring in such out of the box thinking for me. And you've been an inspiration for me. And I know you've inspired hundreds of, probably even thousands of other pharmacists throughout the nation. So we appreciate all that you do. So part of that, I just got back from the NCPA annual. Tripp was awarded the NCPA Independent Pharmacist of the Year. Well deserved. I super proud to say that I know this guy. And so tell me what that means to you. I mean, I'm sure you could probably talk for the rest of the podcast just on this, but just in a few statements, how do you feel this award, what does it mean to you?
Yeah, humbling is all I can really say. I don't really like awards. Yeah, we don't do anything for awards. And I'm humbled that I was nominated and then NCPA chose me and let me stand on the stage there. But we do a lot of work, whether that's through CPSN. Tim, you and I work on tons of projects together. We've got a great staff here. I've got a great team on my CPSN Health Equity team. all I am is the figurehead for a lot of these things. I don't do the actual work. And so, to me, it's a little uncomfortable even getting an award when a lot of the work that's gone into, the nomination is not even work that I did.
Yeah,
So
but
I appreciate it, but like it's, there's so many people that are working really hard on this to do the right thing and go in the right direction. I'm humbled, but just to be fully transparent, I was ready for that weekend to be over because,
sure you're a very humble individual, but it's well deserved. I will say, Tripp, and everybody will agree with me. There's always got to be somebody to help put all these pieces together to make it work. And I know you are a very humble person. You're a very bright individual. You always are looking at the edges and saying, well, but we can take it this way or whatever. And we got to have those people that have that vision. I always try to surround myself with people that are much smarter than me. I know good leaders bring people in that are people that can get things done, and you are definitely that. And so this award is deserving. And I know you're a humble individual, and you feel like you want to move on and not talk about it, but it needs to be talked about because there needs to be more people like Tripp Logan in this world to make our profession run forward. Because we all know, I mean, what we're going through is the status quo is not necessarily going to get us very far. So we've got to look at things in the future. So anyhow, I appreciate what you do and excited to be able to see what's going to come down the road. So anyhow.
Yeah, definitely a great honor there, Tripp. And as Tim described, just blazing the trail, right? I mean, it's a national award, thousands of pharmacies, thousands of pharmacists across the country that are in that same kind of category. But definitely a tribute to you and your family and your commitment to what you're doing down there in the community. So thank you for making that happen. And thank you for coming here today to share a little about some of that action that you're doing in that direction.
Appreciate it, y'all.
So help us out, Tripp, kind of with what's the kind of current practice setting? What's the latest and greatest going on down your direction? I know that you've published a few things there and you speak regularly about it, but for our listeners, share kind of what the latest is, what next envelope you're pushing out there into the frontiers of pharmacy.
So Southeast Missouri, for those that aren't familiar, we're very rural. I'm located, my practices are located halfway between St. Louis and Memphis, a little closer to Memphis if I was going to be closer to one city or the other. And we see a lot of need. So how do you help? Well, and I'll even take a step back. If you surveyed all the pharmacies in Missouri, all NCPA members or whatever, and you looked at services they were providing to their local community, most of the time they didn't choose those services. Those services there's a need for that service. And that's why, like, we don't do travel vaccines. Like, my folks don't hardly even leave the county. So travel vaccines don't make a lot of sense. But setting up transportation and helping close care gaps, finding ways to get people into primary care, a specialist that need help, or finding assistance and low-income subsidies and the ability to get medication so they can get better. Those are things that walk in our doors. And I feel like that the way healthcare is moving right now, it's moving less local and more more call center, more remote. You see it fairly regularly, more vertically integrated, more aggregated, not in the community. And if you look at the financial pressures that are happening on community pharmacy practice or primary care practice or any other, you're starting to see this a little bit in dental and some other places. It's happening everywhere. So we've got options. We can say, this is a business for, this is downtown, the small town before Walmart. You can say that. You can say that this was small shop before Amazon, or you can say, we're important to the community. And there's value being expressed by us. And maybe it's not the prescriptions we dispensed. Maybe it's based on the relationship and our ability to help patients navigate the healthcare system and get the care that they need. And so we've been leaning in on this for this concept of care coordination and being care gap closers, maybe not acute care settings, but care gap closers for a while. And there's a very large market for those that can close care gaps. And when I say care gap, I mean patient needs an immunization, in between office visits to their primary care, we can close that care gap. Patient needs social determinant health screening, health risk assessment. Patient needs chronic kidney disease screening. They need go on and on and on, A1C, whatever that may be. There's a huge market because guess who's having a big tough time doing this? And Daniel, you know this, primary care. Yeah. Primary care is not seen, when in my area, and I know it's the same everywhere. When a patient walks into primary care, usually it's based on an acute issue, and there's all kinds of stuff going on. And when you have a complicated patient that's got complex issues, maybe they're running a fever, maybe they've got pneumonia, but also their A1C is high. They're probably due for some labs. They're due for a flu shot. All that's not going to happen at that visit, and that person may not show back up for another year. So in between visits, there's a huge market for local places, local people that can close care gaps. And I feel like pharmacists, community health workers are in a prime position to not only capture that patient life and help them on their journey, but also include ourselves in some of the payment structures, whether that's through shared savings, fee for service, value-based. We're seeing a huge shift in attention, not only from primary care groups, but we're also seeing health plans, Medicare Advantage, Medicaid across the country saying, we may be our own worst enemies in this race to the bottom on reimbursement, that we're removing access points to care in the community through pharmacies. We already saw it in primary care. Now we're seeing it in pharmacy. This could be bad. And I'm a very positive silver lining person, and usually look at things if there's disruption, if there are problems, there's an opportunity for someone, and where's the opportunity? And I feel like with all the DIR and pharmacies closing, now's the time to express value. And I feel like we're doing a wonderful job of that in Missouri. I'm so proud to be a Missouri pharmacist, part of CPS in Missouri and NPA right now, because we're seeing things and gaps close, seeing opportunities in Missouri that just aren't happening in other places. And I think it's a way for us as a profession to say, look at us. There's a risk of us disappearing, but you need to keep us around, and here's how we're going to do it.
Absolutely. I knowing you over the last, I don't know how long we've known each other. I've seen, pharmacy in the dispensing side decline. People don't even want to go into pharmacy anymore because of all the pressures and all the things that are going on. But I've never been more excited about the opportunities for pharmacy because of the way the things you're talking about, the way this profession is moving into other areas. Community health workers. I didn't even know what a community health worker was until I talked to Tripp Logan. And now, and I think this is a good probably reason why you won your award, is because you're opening people's eyes up and you're actually giving the opportunities. There's a positive, like you say, a silver lining to all this. I'm not saying it's always great, but like I said earlier, I think not letting grass grow under your feet is important for everybody to take a lesson from. So I applaud you for that, and I appreciate what you do. I think community health workers have really added a new movement to community pharmacy, and it's really created another very valuable arm for what we can offer to our communities. So thank you for that.
Yeah, Tripp, you really have the trifecta there, right? One is you're filling that gap and taking care of patients, but you're also out there teaching and educating others how to do it. You're not keeping that to yourself. You are an open book and letting others come in and learn your model. And three, you're doing it and able to stay in business. You're actually figuring out a way to make a business out of it and make it successful. So the trifecta is really a wonderful thing to have.
I still have people that ask me, when I talk to them about community health workers, well, how are you getting paid? Are you billing? And the very first conversation I had is the same conversation you've talked about, is what do community health workers do for you? The worst thing is they'll be your PR people, right? Tell me a little bit about what conversations you have about community health workers.
Yeah, and I love this conversation too, because it checks a lot of boxes of where I like to live. On the super forward, like, current conversation, it's like, are community health workers a fee for service or a value based? Like, how does that help, right? Are we talking about we want to bill for community health worker time, or are we saying that this is a key to prevent people from having transplants or end-stage renal disease, right? So that's it. But going back to the original, my aha moment was I walked in, I was work. I love primary care. I grew up in a community where we knew all our local docs before nurse practitioners. My dad was friends with them. When I was in pharmacy school, they would talk about multidisciplinary work and pharmacists working with physicians. And it's when I realized, I was like, I grew up in this because my dad worked with the local physicians going back to when I was a kid on, trying to take better care of people. So we're lucky in that. And I love working with local primary care and figuring out ways to work better together. So I say that in huge appreciation for what happens with family practice and primary care and the pressures on them as well. I was at Federally Qualified Health Center. Some friends of ours that worked there. Actually, a lady that was went to high school with me was a quality director in FQHC and called me and said, "Hey, Tripp, we've got some issues." This was a long time ago. We've got some issues with some quality metrics at and I know you look at this stuff, and I've done work at PQA and whatever. So I was like, "Yeah, I'll come up there." So I said this FQHC. I was talking to the CFO, CEO, and the quality director, and we were all sitting there talking. And we got figured out what they wanted to figure out. And we were talking about just ways we can collaborate and so on. And they said, "So what's going on? Like, I'm sure some cool stuff's going on down there. Like, what are y'all doing?" I said, "Well, we just onboarded our first community health worker." And they said, "You did? Well, we've got community health workers. Can we cross-refer community health workers? Because we have some people in your community that we would like to hand off to your community health workers." Like, absolutely, no big deal. So now we have contracts with this FQHC to do care coordination and so on. And guess what wouldn't have happened? If I would have said, "I've got a technician that's really good at care coordination," that would never have happened. Ever would have happened. It made me realize that when somebody says pharmacy technician, even though I view our pharmacy technicians as the best care coordinators that you could ever have, the outside world sees them as like those people that count by fives and dispense medicine. So we needed to rebrand our value. And that's what community health workers is. Even like to Tim's point, even if it's just marketing, like right. Even if it is just our techs are different because they're community health workers, forget billing, whatever. Now, we have seen a huge amount of value and billable opportunity through community health workers, which that's a whole nother podcast. Right. Probably. But it's basic. It is value expression. How do we express value as we're different? And having community health worker on staff is seen as different.
Absolutely. Well, I totally agree. And I keep telling people, just wait. There's more things coming. For sure.
So Tripp, what is next? What's coming next? I agree that we ought to do a podcast just on community health workers, but what is your next little frontier? What do you see down your own road?
So my favorite, I tell you what I don't like about being like me and in my practice. I never have, is going out and trying to find a new opportunity and them saying, "Well, we wish everybody was like you." If we had a bunch of LNSs or Logans or you had coverage in our area, then it'd be great, but we just can't do this because you don't have enough coverage. Well, what's happening now is there is coverage, and the coverage is called CPS in Missouri. And that's what I'm excited about is we have community health workers and social determinant health specialists in pharmacies across the state of Missouri that have expressed a ton of value this year that's getting national attention, getting attention from provider groups, from health plans, from health systems, from CDC, from CMS. They are recognizing that we are different, which takes the whole barrier away. That allows us to go out and secure service delivery and dispensing, right? And keep these pharmacies doors open in Missouri and beyond, but Missouri's the epicenter. So what I'm excited about and where the new things are is we can expand this out. And when everybody in Missouri does better, that means LNS does better. Our pharmacies do better. And so we can't do this by ourselves. We can't be the only, and Dad and I've had this philosophy since day one. We gain nothing if we're the only pharmacies left. Gain absolutely nothing. So we really need to make sure that we're aligned with others. And so proud of the pharmacies in Missouri where we are and like what's to come. There's a lot of opportunity right now. Really excited about what the next year or two looks like.
I agree. I think, we're in a boat and we all have an oar, and it's our job to start paddling together. And, Tripp can't do it by himself. Tim can't do it by himself. Daniel can't do it by herself, but all of us together rowing together is going to be able to move forward and do all the things we need to do. So I don't know where I put that.
Can I use this opportunity also to say none of this would be possible without NPA.
Absolutely.
NPA went out on a limb years ago and supported the CPSN initiative. I will be the first person to say that I didn't know that was the best thing for NPA or for CPSN Missouri.
Yeah, we had that conversation. I remember
We did.
Yeah.
I mean, it was rocky in the beginning, but NPA stuck behind it, invested in this, and pharmacies in Missouri are doing better. I think NPA has gained members. CPS in Missouri has definitely gained members, and we only see upside from here, from my perspective. So this is my way of saying thanks to NPA for recognizing this early. And I know the NPA is involved in this podcast, and I'm trying to say this as often as I can because it was rocky in the beginning, and it has turned out to be an example of what others should do.
I totally agree. I think Ron and Annie and Robin and all those guys have done a good job with saying they may not know everything of what we're doing in the board. Yeah. And I know that board changes. I mean, as we go, I mean, Daniel was on the board same time I was. He was coming in as I was going out. And, the board changes, but they all have the same mission to push the profession in our state forward. And I think it's great to be able to have that support for sure. Annie's been a rock star. So appreciate you saying that for sure.
Fantastic. So Tripp, what is your advice for the next generation? We do have a fair number of students that are listening to our podcast. What kind of advice do you have for that next group?
Yeah, I'm under a lot of pressure. Tim knows what this pressure feels like. Also is an independent owner. My oldest is in his second year he's a sophomore in early entry pharmacy program down at University of Mississippi. And he's wanting to come home and practice. So my advice is, buckle up and hang on, because it's going to look different by the time my son gets out of school than it looks right now. Because if you look back, 6 years ago, 5 years ago, it looks completely different now. My advice is to think of dispensing in a pharmacy differently. Dispensing is a way to engage a patient to close care gaps. It's not a way to get them medicine. We're not looking at prescription management. I don't love MTM. Really, we're looking at patient care coordination and holistic patient care. Somebody may not be getting their insulin filled, not because they're non-adherent to the insulin therapy, but because they don't have a refrigerator or transportation to go to the endocrinologist, or the out-of-pocket cost is too high. And we have not been trained to think that way in pharmacy school. So holistic patient care, making sure the patient has the right dose for the right person, right out-of-pocket cost, accessible, all those things. That's what students really need to be thinking about, and how we need to be thinking about positioning community pharmacy practice is the entry point to healthcare, to where we can feed back into primary care. We can feed back into specialty. That's not always how, students typically see, hospital or retail, right? Or community or AmCare, right? No. This is AmCare. Like, we have to practice AmCare in the community setting, or there is no community setting. Everything comes from the mail order kiosk or whatever.
Yeah. I like what you said. Buckle up, hang on. It's going to be a wild ride. It's kind of like the pharmacy rodeo, right?
Right.
I think I totally agree. And that's what I told my son when he started working here. I said, the way I started and the way you're starting are two different things, and it's going to be different in a few years, and it's going to continue changing. He's like, let's do it. There are days he comes to me, he's like, I don't know how much longer we can do it this way. We're going to have to. But the great thing is, we've got leaders like Tripp Logan and other leaders throughout the state that can help give us help give us some vision about how to move forward and do things a little bit differently, still follow the law and do all the things that we need to do to take care of people. But yeah, I totally agree with you. Buckle up, hang on. It's going to be a wild ride. Some people may not like that. But I tell my students it's an exciting time in pharmacy when they come in, for sure. So anyhow, Daniel, do you have anything else? I've got we're kind of winding down here. So
no, Tim, let's go to your final question. That's good.
Okay. So I do try to do this periodically on many episodes. A lot of people know Tripp. I've known you for a while, but I don't know if you've had time to think about it since I mentioned it right before the podcast, but why don't you if you don't mind, tell everybody something about Tripp Logan that not everybody knows. It doesn't need a 10-minute explanation, but just something unique about what is unique about Tripp Logan?
I don't know that there's a lot unique about. So Tripp Logan is a workaholic. I've got 3 kids, wife. We work really hard to spend as much time with them as possible. My career path was never intended, at least in my mind, for this. Like I was when I was getting out of high school, I was a criminal justice and chemistry double major, and the only reason I ended up in pharmacy school was because, I either wanted to go in the FBI or be a U.S. attorney. That was my path. But I was wanting to go to D.C. and really change the world was what my goal was. And one of my criminal justice professors, her husband was an FBI agent. She was a former U.S. attorney, which I was really close to her. And she said, FBI is really looking for pharmacists right now. And this was like early in the methamphetamine days, opioid epidemic hadn't really come to fruition yet. But what they were finding was a lot of illicit drugs, included prescription drug products, and they needed a pharmacist in the FBI. So I took the PCAT and applied to pharmacy school, was on a long waiting list, barely got in, finished in the bottom third of my class, but ended up coming back and practicing, never intending to do what I'm doing right now.
Yeah. Well, that's an interesting story. Now, your father is in law enforcement, right? Or was in law enforcement?
My dad's retired from law enforcement. He was a 25-year law enforcement officer. He created the first multi-district prescription drug task force in the country during the methamphetamine and early opioid epidemic. Yeah. Interesting growing up in that environment.
There's a whole nother podcast, right?
Yeah. Right. Yeah. And I grew up with that.
Yeah, that was an interesting thing about you. I didn't even know that, and I've known you for a long time. So that was very insightful. So good to know. So, Daniel, got any final comments?
This is great, Tripp. We really appreciate you being with us here today. And you've given us 3 more podcast ideas, including the community health worker, the CPSN. Now, get your father on here as far as the law enforcement piece of it, but really,
I'm not responsible for that one. I'll take responsibility. I'm not responsible for that one.
Well, congratulations to you and your family and your pharmacy practice for being recognized by NCPA as the Independent Pharmacist of the Year. Much deserving, and we really appreciate you role modeling those behaviors. We'll give you a final word, and then I'll exit us out then.
No, I just encourage the listeners to subscribe to this podcast and continue to listen. I told these gentlemen before we start recording, I'm a regular listener. I love the content. I love the laid back approach, and it's something that helps me on my drive when I'm driving from place to place. I can listen to this and just get a feel for what's going on out there. So I encourage all the listeners to share with your friends.
Well, thank you to our listeners for joining us today for the Pharmacy Frontiers podcast. Please share this episode with your friends and seek out the previous Pharmacy Frontiers podcast on your favorite podcasting channel. Until next time, remember, it's a good day to bring value to pharmacy.